The Ontario Medical Association is pushing back against the move to allow pharmacists to diagnose and treat more ailments. The group's president says doctors receive thousands of hours of training and pharmacists may not be able to assess more complicated illnesses that could be a sign of a serious condition. Meanwhile, the CEO of the Ontario Pharmacists Association says any notion that there is an increased risk to patient safety is misinformation. The Ontario government is looking into further expanding pharmacists' ability to treat ailments to include sore throat, mild headaches, fungal nail infections, and nasal congestion. And joining us now with more on this is Dr. Dominic Nowak, the president of the Ontario Medical Association. We appreciate your time, doctor. I want to highlight some of your concerns. You're talking about the fact, or the claim is that many of these pharmacists might not be able to diagnose certain ailments that could, I guess, be a sign of a bigger problem. What are some of those examples?
Look, our healthcare system is in crisis. 2.5 million people can't find a family doctor. And rather than looking at Band-Aid solutions, what we're advocating for is let's find everybody a family doctor and let's have health professionals working together for their care. And when I think about some of the ailments here, like sore throat, like headache, the number of times that someone's come into my office, I'm a family doctor, with that as the presentation, but it ended up being something serious. It takes a doctor to know that. That's our bottom line here.
We've been speaking to so many pharmacists. We've spoken to a lot of people about the expansion of this, of treatments or what pharmacists can treat you for. And there was a widespread consensus from a lot of those people that they wanted to have more options. Yes, there is the argument that maybe some of the staff might impact staffing at hospitals, but there seems to be a growing consensus that people want to have more options. So what do you tell those people in response to that?
I want people to have options as well, and I'd say those options need to be within a team. And that's why we're advocating for what's called team-based care. And we need our government to step up and have health professionals working together rather than pulling us apart. And that means working in teams where everybody has a family doctor, but those family practices have pharmacists, have nurses, have other health professionals all working together for people's care. So people can get care that makes sense rather than right now further fragmenting our healthcare system, which is exactly what this policy does.
Would the OMA be open to, I guess, working on some sort of plan to make sure that some of the concerns are addressed from the pharmacists, that if they're not experienced or trained to a certain extent, that the government and the OMA work with pharmacists to make sure that they are up to speed on certain treatments so that they can go ahead and maybe alleviate some of the stress that is currently impacting our healthcare system?
Make no mistake, we've been working with government and advocating with government to make sure everybody can get access to a family doctor and towards what's called team-based care, which means doctors, pharmacists, nurses, other health professionals working together. That's what we're calling for, and we need a government that steps up and matches everybody to the care they need.
I'm curious, doctor, a lot of people who don't necessarily have a family doctor, they are going to the ER to get treated, and oftentimes these are treatments that didn't necessarily require a trip to the ER. So I'm curious, wouldn't this alleviate at least some of the burden off the hospitals that are clearly backed up? Staff are overworked, they're overstressed, and they don't necessarily have the resources. Wouldn't this alleviate some of that pressure?
Yeah, I'd want to challenge that assumption that some of the presentations that are coming into pharmacies are actually diversions from the emergency room. What we're seeing coming into the emergency room are actually people who need care from a family doctor, who need care from a team. And that's why we need a government that steps up and creates the healthcare system that we can be proud of again, rather than further fragmenting our system with ideas like this that actually don't make sense in the long run.
And Dr. Nowak, what's been the response, or if any, from the health minister when addressing these issues?
We've been working with the health minister and with government on this and other ideas for years. The main idea that I'd present for Ontarians to call on their MPPs and elected officials to do is find everybody a family doctor. When you can't find a family doctor, you end up using the emergency department more often, you end up costing the healthcare system more money, you end up being in hospital more often, and all of that makes our healthcare system less sustainable in the long run. And if people have a family doctor and ends up stabilizing our system, that's the foundation of care that everybody in Ontario deserves.
Dr. Dominic Nowak, president of the Ontario Medical Association, we appreciate your time. Thanks for joining us.